At some point, many people open their medicine cabinet, look at the rows of pill bottles, and quietly ask a question they're afraid to say out loud. Do I really need all these medicines? Morning pills, night pills, pills for blood pressure, cholesterol, sleep, pain, mood, digestion. And somewhere along the way, it starts to feel like your life is organized around medications instead of living. According to Dr. Sanjay Gupta, this is one of the most common concerns older adults share, and it's a very reasonable question. Asking it doesn't mean you're irresponsible, and it doesn't mean you're rejecting medical care. It means you're paying attention. Modern medicine has saved countless lives, but more medicine doesn't always mean better health. As people age, they're often prescribed medications gradually, one at a time, usually for good reasons. But over the years, those prescriptions can add up. This is known as polypharmacy, which simply means taking multiple medications at once. The problem isn't just the number of pills, it's how they interact with each other and with a changing body. As we age, the liver and kidneys process medications more slowly. That means drugs can stay in the body longer and have stronger effects than intended. A dose that worked perfectly at 50 may feel very different at 70. Side effects like dizziness, fatigue, brain fog, balance problems, constipation, or sleep issues are often blamed on aging, when in reality, medications may be playing a role. Dr. Gupta explains that some symptoms people accept as normal aging are actually medication effects. Feeling unsteady, feeling tired all the time, feeling mentally dull. These are not always inevitable, but they often go unexamined. Another issue is something called the prescribing cascade. One medication causes a side effect. That side effect is mistaken for a new condition, and another medication is added to treat it. Over time, the original problem gets buried, and the medication list grows longer. This doesn't happen because doctors are careless. It happens because medicine is complex, and appointments are often rushed. Specialists focus on one organ system at a time, and no one always steps back to see the full picture. Dr. Gupta emphasizes that this is why asking questions is so important. Not challenging your doctor, but partnering with them. Questions like, what is this medication for? Is it still necessary? What happens if we reduce or stop it? These are not dangerous questions. They are responsible ones. Another important truth is that some medications are absolutely essential. Blood pressure drugs, diabetes medications, seizure medications, and others can be life-saving. The goal is not to stop everything. The goal is to understand what you're taking and why. Dr. Gupta often reminds people that medicine should support quality of life, not quietly reduce it. If a medication helps you live better, it's doing its job. If it makes daily life harder, that deserves attention. There's also the emotional side of medication use. For many people, taking many pills becomes a symbol of aging, dependence, or loss of control. That emotional weight matters. When people feel like their body no longer belongs to them, anxiety and sadness can grow. Addressing medications thoughtfully can restore a sense of agency and confidence. The most important message Dr. Gupta shares is this: never stop or change medications on your own, but always feel empowered to review them. A regular medication review with a trusted doctor or pharmacist can reduce unnecessary drugs, adjust doses, and improve how you feel day to day. This is not about rejecting medicine. It's about using it wisely. So if you've ever looked at your pill bottles and felt overwhelmed, confused, or worried, you're not alone. That question you're asking, do I really need all these medicines, is not a sign of doubt. It's a sign of awareness. And awareness is often the first step toward better, safer, more balanced health.